These are the learning objectives for human trafficking in the healthcare setting. Define the two types of human trafficking. Describe the economic, social, political, and cultural factors that contribute to human trafficking. Explain the psychologic, health, and social consequences of human trafficking. Identify the warning signs and interviewing strategies to assess and identify human trafficking victims in the healthcare setting. And finally, describe appropriate steps in reporting, interventions, and resources for victims of human trafficking. Human trafficking has always been a part of human history. Human trafficking is a modern-day form of slavery. Human traffickers prey on the weak and vulnerable. Every year, millions of women, children, and men all over the world are compelled into prostitution or forced labor by violence, coercion, deception, or a combination of all three. The victims are from many different backgrounds, but the common denominators they share are their desperation and limited resources. The perpetrators of human trafficking target people who simply cannot fight back, and human trafficking places these people into situations from which there is little chance of escape. However, in recent history, it has become a crime where the victims and the atrocities are hidden in plain sight. Human trafficking is an industry that globally exploits an estimated 21 million men, women, and children for more than $150 billion each year. Fortunately, human trafficking is finally coming to the forefront of public awareness, not only as a horrific criminal act, but also as a public health issue that causes severe harm to individuals, families, and communities. With this increase in awareness, the public is now reporting human trafficking occurrences in greater numbers. According to the National Human Trafficking Hotline, during 2016, the hotline received 26,727 calls and 7,621 human trafficking cases were reported, which is a 37% increase from 2015. Furthermore, due to current legislation and increased media coverage, healthcare providers are also becoming aware of the need to learn more about human trafficking. Unfortunately, though, as healthcare professionals seek information, it can be difficult to separate true data and information from the sensationalized version conveyed through the media. Due to the nature of this issue, statistics related to human trafficking can be unreliable. Human trafficking is a health issue that lives in the shadows. No one can definitively say how many are enslaved for labor or sexual practices. Data can only be extrapolated based on the number of cases reported and confirmed, or when survivors are surveyed. With this in mind, several studies report that 28 to 88% of human trafficking victims did have access to medical care while in captivity. This indicates that if healthcare workers are educated on identifying and responding to human trafficking victims while they are seeking care, these victims could potentially be freed from captivity. Unfortunately, surveys of healthcare providers indicate that 80 to 95% report never receiving formal training on proper response to human trafficking in the healthcare setting. As a result, many healthcare providers state they do not feel confident in their ability to identify a human trafficking victim, or if a patient is suspected of being a victim, how to respond appropriately. For obvious reasons, specific specialties such as emergency care and obstetrics benefit from human trafficking education, and this training is now being required by some states. However, even those who work in other areas, such as surgery, can also benefit from human trafficking education. While an anesthetist may not interact with a victim still in captivity, it is very likely that many human trafficking survivors will require the services of a CRNA. The following is a story from a human trafficking survivor, Andrea. Andrea was trafficked at the age of 12. She came from a dysfunctional home and suffered abuse as a young child. When she was 12 years old, she finally had enough and ran away. While out on the street, she met a couple who seemed very kind and caring. They offered her food and a ride. This ride was the beginning of her sex trafficking. Andrea is now 36 years old and suffers from chronic medical conditions related to her time in captivity. She has severe PTSD and anxiety disorder. She also suffers from GI disorders, which is common for human trafficking victims. As a result, she needs to have an EGD. While checking into endoscopy, she made the nurses aware of her PTSD. Andrea was very anxious, yet quiet and compliant. After entering the PTSD diagnosis into her chart, no one seemed to think about it again. Andrea was wheeled into the endoscopy suite and placed on her side in preparation of the procedure. At this point, the anesthetist appeared at the head of the bed and said a few words as he started injecting the anesthesia into her IV tubing. What was routine for this anesthetist, approaching the head of the cart outside of the patient's view, startled Andrea. This small event triggered a flashback, creating extreme distress as Andrea was being sedated. As a result, the sedation was difficult as Andrea fought against the medication and the procedure. Once the EGD was completed and Andrea woke up in recovery, she discovered she now had chipped teeth due to biting down and fighting against the bite block. Her body hurt all over as if she had been beaten. Andrea states, "I felt like I had been in a real fight." This incident happened over a year ago, yet Andrea still has nightmares related to this unfortunate experience. In a modern, wealthy country such as the United States, it would be easy to assume that incidents of human trafficking would be an aberration. However, it is not. The United States Department of State issued a recent report entitled Trafficking in Persons Report 2018 that stated that during 2017, the Department of Justice secured convictions against 499 traffickers, an increase from 439 convictions in 2016. There were 471 traffickers involved predominantly in sex trafficking and 28 involved predominantly in labor trafficking, and some involved in both. These reports did not include child sex trafficking cases brought under non-trafficking statutes. Human trafficking does include the popularly reported incidents where young women are forced into prostitution. While sex slavery involving young women is a large part of human trafficking, children and men are also victims of this trafficking. Human trafficking is not limited to illegal businesses. It can be found in a wide variety of legal businesses, industries, and services. Human trafficking does not always involve the moving or smuggling of people from one country to another. The victims are often citizens and residents of the country in which the violation occurs. These conditions, which are important aspects of human trafficking, clearly underscore a chilling point about this crime. Human trafficking and its victims are often hidden in plain sight. Some experts feel that the incidence of human trafficking has been underestimated, while others stated it has been overestimated. Reliable figures are reportedly difficult to find because of the illegal and therefore hidden nature of this problem, the range and severity of trafficking activities, and the variation in the definitions used. Worldwide, in 2016, the United Nations International Labor Organization, or ILO, estimated an approximate 40 million human trafficking victims, of which 25 million were in forced labor and another 15 million in forced marriage. Additionally, 152 million children aged 5 to 17 years were reportedly in forced labor. The United States Department of Labor reported that in 2016, there were 139 goods from 75 countries produced by child labor and forced labor. And in 2015, an estimated that 1 in 5 runaways were likely forced into sex trafficking, an increase from 1 in 6 the preceding year. In 2015, the United States National Human Trafficking Resource Center published that human trafficking had been reported in all 50 states and the District of Columbia. Worldwide and in the U.S., countless numbers of children are forcibly employed or sold to others for forced employment. The Victims of Trafficking and Violence Protection Act, a law passed by the United States Congress in 2000, lists several definitions associated with human trafficking as follows. Human trafficking victim, a trafficked person who is still in captivity. Human trafficking survivor, a person who was trafficked but is now out of captivity. And the global definition of human trafficking: the recruitment, transportation, transfer, harboring, or receipt of persons by means of threat or use of force or other forms of coercion, of abduction, of fraud, of deception, of the abuse of power, or of a position of vulnerability, or of the giving or receiving of payments or benefits to achieve the consent of a person having control over another person for the purpose of exploitation. Exploitation shall include, at a minimum, the exploitation of the prostitution of others or other forms of sexual exploitation, forced labor or services, slavery or practices similar to slavery, servitude, or the removal of organs. Now we will look at the various definitions of trafficking. The U.S. definition of sex trafficking: the recruitment, harboring, transportation, provision, or obtaining of a person through force, fraud, or coercion for the purpose of a commercial sex act, or in which the person induced to perform such act has not attained 18 years of age. This includes prostitution, survival sex if under 18, pornography, escort services, exotic dancing, massage parlors, child brides, and forced marriages. In some countries, prostitution is not illegal, or it is considered a crime of relatively minor importance. However, someone who engages in prostitution because of being coerced or forced to do so, or when the use of fraud or threats has been involved, has become a victim of sex trafficking, which is a crime. In those circumstances, anyone who has enticed, harbored, patronized, recruited, transported, or solicited another person for sexual activity is guilty of sex trafficking. Sex trafficking predominantly affects girls and women, and in many parts of the world, the lack of legal rights and the economic disparities attached to gender make girls and women especially vulnerable. Girls and women are promised jobs with relatively good wages, and once away from home and family, they are then exposed to isolation, threats, and violence that hold them prisoners. Forced marriage is different from arranged marriage. In the United States, forced marriage occurs when a young girl is taken from her home, returned to the country of her family, and forced to marry. Resistance or refusing to marry puts her at risk for physical abuse and even death, and forced marriage is associated with increased rates of domestic violence, rape, and suicide. Now we will look at labor trafficking: the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through the use of force, fraud, or coercion for the purpose of subjection to involuntary servitude, peonage, debt bondage, or slavery. This type of slavery is commonly found in agriculture, construction, restaurant, bars and clubs, domestic work, factories, hospitality, and door-to-door sales crews. It can be combined with sex trafficking and often includes sexual abuse. It does not require money to change hands and can include domestic servitude in the home of the trafficker. Human trafficking does not always present the same on the surface. Each victim, trafficker, and circumstance is different. At the core, though, the victim is always exploited through the use of force, fraud, and/or coercion. As with every situation, there are certain risk factors that make some more susceptible than others to victimization. Traffickers are very aware of these vulnerabilities in others and will exploit them for personal gain. The common thread among human trafficking victims is desperation due to poverty and homelessness, or emotional wounds with a need for love and acceptance. The following include risk factors for labor trafficking and sex trafficking. Due to these risk factors, victims are easily lured away through the use of fraud from their support system and into a life of human trafficking. Once victims are isolated, either physically or emotionally, traffickers can then maintain control through the use of force and/or coercion. It is important to note that these definitions clearly state that human trafficking does not necessarily mean the moving or smuggling of persons. Human trafficking is the dealing or sale of humans as a commodity for profit. Finally, we will briefly look at organ trafficking. Organ trafficking can take one of three forms. The victim can be forced or deceived to relinquish an organ, may agree to sell an organ but will not be paid, or may be fraudulently treated for an ailment and the organ unnecessarily removed. Human trafficking is a multi-billion-dollar enterprise. Identifying a victim of human trafficking has many similarities to recognizing a victim of interpersonal violence involving domestic or intimate partner abuse. Although there are validated assessment tools for identifying people who are victims of human trafficking, there are certainly clues and signs that should alert the health clinician to the possibility. Not enough is known about whether assessment tools to screen for victims of human trafficking are effective or sensitive to either sexual or labor exploitation. Unlike the selling of drugs and guns, people can be sold over and over again. Therefore, if a human trafficking victim has a severe injury or illness, the trafficker may allow the human trafficking victim to seek medical attention. It is important to note that sex trafficked victims are more likely to be allowed to seek medical care than labor trafficked victims. The healthcare setting is the one place where victims may be identified and offered resources, giving the victims a chance to leave their life in captivity. For this reason, all healthcare providers should be aware of human trafficking red flags. The following are red flags to trigger further screening for human trafficking. The following are labor trafficking indicators, and these are sex trafficking indicators. It is important to note that a single red flag or even a few red flags does not automatically indicate that a patient is a victim. However, the presence of red flags or even a gut instinct that something isn't right should be followed up on by someone trained to work with human trafficking victims. When initially recognizing that a patient may be a victim of human trafficking, the manner in which the assessment and resulting care is conducted is crucial. In addition, speaking with a human trafficking victim in private without indicating suspicions to the trafficker is of utmost importance. If human trafficking is suspected, a focused private interview should be the next step. The questions should be non-judgmental, open-ended, and framed in a way that encouraged the patient to talk. Interviews with human trafficking victims found that the victims would be more likely to be open and candid if the healthcare professional appeared to be knowledgeable about trafficking, was respectful, and showed a non-judgmental attitude. The following table includes examples of questions that may be helpful during the interview process. The interview question categories are arbitrarily chosen and there is clearly overlap between them. The goals when asking the following questions during the interview process are to encourage the interviewee to open up and provide basic life details. These details would not be particularly important for most patients, but are crucial in an individual's life circumstances related to work history, perceptions of safety, and personal history. The interview process can be delicate and difficult, and in the field of anesthesia, we do not have the opportunity to delve this much into a person's history. But if victimization is suspected, it is imperative that we find someone qualified who can investigate further. Trying to help victims of human trafficking to talk about their status is potentially very dangerous for them and requires an enormous level of trust. The healthcare professional who knows how to ask human trafficking victims to reveal their status is suggesting to them that if they take a risk to disclose their statuses, that they will be protected. Health professionals carry an ethical obligation in situations of suspected human trafficking. Mandatory reporting systems that fail to meet intended purposes of providing victims with a safe transition away from their situation of abuse can be devastating. Trafficking victims and survivors, youth or adults, who are aware of a reporting system will need assurance of safety or they will likely avoid seeking care or disclosing information about their traffickers. Immigrants who are victims of human trafficking will be fearful of deportation and avoid disclosing their situations. Certain consequences of human trafficking, like gunshot wounds, stab wounds, child abuse, intimate partner violence, sexual assault, or immediate threats to a patient, are covered by mandatory reporting laws, and these situations should be reported to the police. However, the requirements for mandatory reporting of human trafficking itself vary from state to state. For example, some states have requirements for reporting sex trafficking and some for reporting labor trafficking. Unless required to by local laws, or unless there is a reportable consequence of human trafficking, instances of suspected human trafficking cannot be reported to legal authorities if the patient is competent and has not given permission to do so. This situation would seem to be the worst of both worlds, knowing about or suspecting the presence of a particularly horrible crime but being prevented from intervening. Patient safety is a priority, and if there is no immediate danger, the administrative and/or legal departments of the healthcare facility should be consulted. A valuable resource is the National Human Trafficking Resource Center hotline. The National Human Trafficking Resource Center operates a hotline that is available every day, 24 hours, at 1-888-373-7888. The NHTRC can provide information, guidance, and resources for healthcare professionals who have questions about human trafficking. The Joint Commission provides health teams with a quick safety protocol for identifying victims of human trafficking. Interdisciplinary health teams need to be informed that the United States is considered one of the largest markets and destinations for human trafficking victims in the world. Healthcare organizations need to educate all staff on how to identify these victims and when to solicit the help of law enforcement. Knowing the community resources available to assist human trafficking victims is critical for all healthcare professionals who may become involved in assisting victims. The Joint Commission emphasizes the importance of the patient-centered approach and encourages healthcare professionals to consider human trafficking situations as unique, case-by-case situations. Some human trafficking victims will not be ready to seek assistance and cannot be forced to report. However, vulnerable populations, like those that are less than 18 years, may be reported to the local Child Protection Services authorities, and healthcare professionals are legally obligated, as previously mentioned, to do so. At times, human trafficking victims may also develop trauma bonding or Stockholm Syndrome with their trafficker. Similar to domestic violence, traffickers, frequently referred to as Romeo pimps, will alternate between violence and reward. This keeps the victim off balance emotionally and perpetuates the belief that they are in a long-term romantic relationship with their trafficker. Through this act of grooming, the trafficker gains mental control over the victim. Grooming is achieved through repetitive physical and emotional trauma, living in a state of constant fear of the unpredictable bouts of violence, as well as threats to harm of the victim's family. Eventually, human trafficking victims are convinced that their trafficker is all-powerful. In trafficking situations that involve debt bondage, victims are told that they owe exorbitant amounts to their trafficker. Debt bondage may occur due to drugs or being illegally smuggled into the country. Debt bondage is a form of human trafficking that involves the use of debt to hold someone in servitude. This bondage is especially common for migrant workers and foreign nationals who travel for employment. Once these people are in a situation where their financial obligations to an employer have accumulated past their ability to repay, debt bondage can effectively make the worker a slave and/or prevent them from leaving. It also makes them vulnerable to being used as a commodity or possession, being bought or sold. Domestic service is a common form of human trafficking in the United States and around the world. Foreign nationals can easily be hidden from authorities inside a private residence. They are often the only employee, they do not speak the native language, and they have no support. In addition, money, personal identification, and resources are withheld, and the individual or individuals acting as an employee can always threaten to have the victims exposed to the Immigration and Naturalization Service and deported. Traffickers then make it difficult to pay off the debt and even threaten to harm their family or deport them. Traffickers then make it difficult to pay off the debt and even threaten harm to their family or deportation. Human trafficking depends on coercion, emotional abuse, fear, lying, manipulation, and threats, essentially any harmful and negative emotions. This treatment, combined with the loss of freedom and the hopelessness experienced by human trafficking victims, has profound emotional consequences. Human trafficking victims frequently suffer from a wide variety of psychological problems, such as addiction, anxiety, depression, eating disorders, emotional dysregulation, hostility, hypervigilance, insomnia, low self-esteem, normalizing of sexual violence, shame, suicide, PTSD, and traumatic bonding. Emotional dysregulation is a condition in which an individual's emotional response to a situation is considered very abnormal. Emotional dysregulation is a common feature of PTSD. Traumatic bonding is a relationship in which the bond between two people is based on intermittent cycles of fear and pain with pleasure. This relationship is complex, but it essentially involves isolation, complete or perceived to be complete power by one person over another, a real or perceived threat to kill or harm the victim, and occasional acts of kindness by the perpetrator. Humans are programmed to form attachments, and although the bond of a human trafficker to the victim is grossly abnormal, the victim has no one else. The victim needs a trafficker because a trafficker supplies the basics to sustain life, and because a trafficker provides some level of pleasure, albeit very small and intermittent. The victim soon learns that to survive, it is psychologically better to become attached to the enslaver. PTSD is a psychological condition that is caused by living through or witnessing an extremely traumatic event, particularly an event that causes fear and helplessness. People who have PTSD suffer from a variety of signs and symptoms such as depression, flashbacks, hypervigilance, and intense mood swings. The risk of suicide has been reported to be very high for victims of human trafficking. The physical consequences of human trafficking affect every organ system. These are identified as musculoskeletal, in the form of fractures and pain, neurological, in the form of memory loss and disorientation, pulmonary, integumentary, in the form of bites, bruises, burns, lacerations, and scars, and reproductive sexual, in the form of abortion or abortions, genital trauma, pregnancy, and STDs. Sexually transmitted infections are very common in women and men who are victims of sex trafficking. The rate of HIV infection in male and female prostitutes is especially high, and there is no reason to believe that this would not be the case for victims of sex trafficking. Sex trafficking is a complex problem because the victim experiences physical and psychological harm. The traffickers use physical violence to dominate and control their victims. Some of the tactics include starvation, beatings, rape, and gang rape. Victims also experience violence and harm from some of the people who are purchasing the sex acts. Some main gynecological consequences include ectopic pregnancies, pelvic inflammatory disease, unsafe and unsanitary abortions, and infections with antibiotic-resistant sexually transmitted diseases. Human trafficking depends on vulnerability. Vulnerability would be caused by an individual's cultural, economic, social, and personal circumstances. Human traffickers exploit these weaknesses to both establish and maintain power over the victim, and they do so not through simple physical force. In the late 1950s, a sociologist named Albert Biederman studied interrogation techniques that had been used to manipulate prisoners of war and make them compliant and accepting, and his work can be applied to human trafficking. Biederman identified 8 techniques used for coercion and to maintain power over another person. These include isolation, degradation, omnipotence, monopolizing perception, indulgences, a threat, trivial demands, and inducing debility. Human trafficking has been increasingly identified by law enforcement and health and public agencies as a public concern, but identifying the victim, as we have discussed, is not easy. This is due primarily to the nature of the crime and because of the isolated and fearful circumstances in which the victims live. Working in a factory or a sweatshop 14 hours a day, doing agricultural labor on a rural farm, forced sex work, or being in debt bondage as a domestic and never allowed to leave the house are examples of such damaging conditions. The victims of human trafficking do not have contact with people outside their world. Some forms of this modern-day slavery involve being out in the public. For example, construction job sites and agricultural work, which is not done in remote areas. Studies have shown that healthcare professionals, particularly in the emergency room, encounter human trafficking victims. These studies did not involve large numbers, but Chisholm and Straker and others in 2012 found that 87.8% of the sex trafficking victims they surveyed had contact with a healthcare professional, and slightly more than 63% had visited an ER at least once. People who are being trafficked are occasionally in the public domain and at times will interact with someone aside from other victims or the traffickers, yet they are not being recognized. Yet others, especially healthcare professionals, are not educated in identifying these victims. If they are not aware, they may not be able to recognize strong cues or have incentive to watch for cues, and there are countless reasons why the victims will not tell them. When victims of human trafficking are seen in healthcare settings, their complaints can easily be explained as being caused by something else. In the ER, unlike the other patients being seen, victims of human trafficking are not forthcoming about how and why they became injured or sick. There are countless reasons, as previously mentioned, for human trafficking victims to not reveal their status, and some of these reasons are listed in this table. Let's consider the following case studies. Case Study 1. An 18-year-old woman living in Thailand is kidnapped and smuggled into the United States. She does not speak English, she has no identification, and is forced into prostitution. Beatings, periodic rapes, and threats from the captors to harm her family and to turn her over to the police are common occurrences. When the patient develops a venereal disease or an injury from one of her captors or an abusive customer, she is brought to a clinic where the staff are paid off and threatened to look the other way. Also, the examinations are strange and embarrassing for her, which furthers her shame about what she has been forced to do. Case Study 2. A 25-year-old woman has been recruited to leave her family in Mexico and come to the United States for a well-paying factory job. Her entry into the country is illegally arranged. The job is real, but she is told that due to the conditions of her recruitment, she must repay $25,000 to the people who brought her here. At her current salary, this debt can never be repaid. In addition, the promised living arrangements have not been provided, and she is forced to buy food from captors at exorbitant prices. She is only allowed to go to work and then is returned to a communal home to sleep, and is forced to work 16 to 18 hours a day. These inhumane conditions are enforced by occasional physical violence, constant threats of violence, and threats to turn her over to the Immigration and Naturalization Services. When she needs health care, she's brought to the ER by one of her captors. Although she speaks sufficient English to make her problems understood, she is instructed to act as if she cannot speak the language, and the captor pretends to interpret on her behalf. In these situations, it is evident why a human trafficking victim would not, and often cannot, ask for help. They do not have the emotional, financial, or social resources to do so. Their circumstances make it virtually impossible for them to ask for help. And finally, the real or perceived cost of trying to break free is far more than most would be willing to pay. Caring for a human trafficking survivor with multiple health issues may be complicated by the survivor's trauma brain or changes in brain morphology. Due to changes within the limbic system, those with this condition suffer from a disrupted neurodevelopment as well as social, emotional, and cognitive impairment. In addition, they frequently adopt health risk behaviors which may increase an already substantial risk for disease and disability. The eventual result is early morbidity and mortality. It should be also noted by healthcare providers that due to the decreased function of the prefrontal cortex and the hippocampus, human trafficking survivors may be poor historians and their decisions emotionally driven. Due to the immeasurable trauma suffered while being trafficked, it is essential that healthcare providers utilize a trauma-informed approach to care. SAMHSA's 2014 Key Principles of a Trauma-Informed Approach highlights the need for safety, trustworthiness, and transparency, as well as empowerment and choice. Healthcare providers need to realize the impact trauma has on all aspects of a person. This involves recognizing and understanding signs and symptoms of trauma, including substance abuse and mental health disorders. Healthcare providers can then provide patient-centered care that empowers and provides hope for recovery. Trauma-informed care is based on a trust relationship and should include providing choices, allowing the patient to be in control, and help to determine their plan of care. Also, if a patient seems in distress, acknowledge that distress and ask what can be done to minimize it, again giving the patient control. The goal is to reduce re-traumatization and to support the development of healthy coping mechanisms. This list is an example of things that you can say. Here is another case study. Chris is a sex trafficking survivor and has been out of the life for almost 15 years. As a result of the extreme abuse that she suffered, Chris has PTSD, severe anxiety, and multiple other health issues. Recently, she required surgery for gallbladder removal. During the admission assessment, Chris informed the nurse of her PTSD and her fear of being combative in recovery. She relates that her children know that if she needs to be awakened, they are to make noise when entering the room, and if needed, they touch her feet. They never approach the head of the bed due to the risk of being accidentally hit as Chris awakens. The pre-op nurse makes note of this in her chart. No further inquiries are made by the nurse related to Chris's PTSD. The surgery went well and Chris was wheeled into the recovery. As she was arousing from anesthesia, Chris recalls, "Whenever someone would come near me, I could hear the nurse call out to them to avoid bumping into me, saying loudly that I had PTSD. This really upset me, but I couldn't say anything because I was so groggy. I started moving around trying to get up. The nurse came over, but I couldn't explain why I was so upset. I then heard the nurse talking to someone, telling them that I was agitated and needed medication. When she started to put the medicine in my IV, I tried to pull away, but she gave it to me anyway." As a result of the difficult time in recovery, it was decided that Chris would spend the night in the hospital. Her anxiety increased, but she was unable to explain why, other than to tell the nurse she needed to go home. Chris kept trying to get out of bed and pulled out her IV. She states, "The nurse then came into my room with medication and started to put it into my IV. I told her I didn't want it, but she said the doctor ordered it so I could relax and get some sleep. This happened 2 or 3 times during the night. Finally, morning came and they let me go home." Because no one took the time to investigate Chris's PTSD triggers, they didn't realize that while in captivity, Chris was held down and forcibly injected with heroin. Each time a nurse put medication in her IV without her consent, Chris was re-traumatized. Chris now has flashbacks involving nurses forcibly drugging her, and she struggles with increased anxiety related to her health care. A wide range of laws have been established to protect human trafficking victims and to prosecute perpetrators. One of these involves the Victims of Trafficking and Violence Protection Act. A general knowledge of these laws is helpful when caring for victims and seeking appropriate social services. The TVPA was enacted in 2000 and reauthorized in 2003, 5, 8, and 13, and 18 by the Trafficking Victims Protection Reauthorization Acts. It emphasizes the 3 Ps: prevention, protection, and prosecution. The prevention component consists of training and awareness. The protection dimension gives trafficked victims the ability to receive services using federal funds like other refugees. And the prosecution component focuses on laws and policies for the prosecution of traffickers. Because victims of trafficking are often viewed as criminals, this law states that victims of severe trafficking should not be penalized for any illegal behaviors or acts they engaged in as a result of being trafficked, including entering the United States with false documents or no documentation, or working without appropriate paperwork. This law also states T non-immigrant status, or T visas, to be granted to victims of trafficking so that they may remain in the United States with the purpose of collaborating with the federal authorities to prosecute the perpetrators. During this time, victims are offered a range of benefits and services, including access to the Witness Protection Program. After 3 years, victims can apply for permanent resident status. One of the criticisms of the Act is that it places the burden of demonstrating innocence and coercion on the victim. The Act also fails to recognize the complex dynamics of human trafficking. For example, it focuses more on sex trafficking versus other forms. Many victims have been abused and terrorized by the perpetrators, who they must now provide information and evidence against to stay in the country. Furthermore, victims between 16 and 24 years of age are eligible for work permits and can apply for the Job Corps program. Many victims have been abused and terrorized by the perpetrators, and they must now provide information and evidence against them to stay in the country. Victims are continually fearful that they will be deported. Victims who are minor age are eligible for unaccompanied refugee minors programs, the Children's Health Insurance Program, and temporary assistance to needy families. Victims between 16 and 24 years of age are eligible for work permits and can apply for the Job Corps program. It is important to remember that the key to this law is that the victim must have experienced a severe form of trafficking, and that the victim must be willing to assist in the apprehension and prosecution of the perpetrator to receive these services. The Preventing Sex Trafficking and Strengthening Families Act. The Preventing Sex Trafficking and Strengthening Families Act was signed into law in 2014. In accordance with this law, child welfare agencies are required to monitor and report the number of child sex trafficking victims. Cases of suspected or known child sex trafficking must also be reported to law enforcement. Now we will take a look at the Trafficking Victims Protection Reauthorization Act. The Trafficking Victims Protection Reauthorization Act was introduced and signed into law in 2013. It allocated $5 million in 2009, $7 million in 2010, $7 million in 2011, and $8 million annually through 2017 to provide services to victims and to prevent human trafficking. It amends the TVPA and assists foreign governments to implement programs to prevent human trafficking. Victims of human trafficking in other countries are also eligible for assistance through organizations that have grants from the U.S. government. Greater monitoring of trafficking trends through databases will also be implemented. The Act also declares that it is not a defense that a defendant is not criminally liable or is subject to reduced criminal liability due to acceptance of the illicit conduct in the foreign jurisdiction. Now, the Prosecutorial Remedies and Other Tools to End the Exploitation of Children Today Act. This act was enacted in 2003. This law maintains that all sexual activity with minors within or outside the U.S. is illegal. American citizens who engage in sex with minors in any country and who are caught will be prosecuted in the United States. As of 2017, all 50 states have enacted criminal and trafficking laws. In addition, every state has a law on labor trafficking, and all have passed criminal statutes for sex trafficking. Finally, the SOAR to Health and Wellness Act. The SOAR, Stop, Observe, Ask, and Respond to Health and Wellness Act was signed into law in 2018. It directs the Department of Health and Human Services to develop a program to train healthcare providers to identify possible human trafficking victims, to work with law enforcement agencies, and to refer victims to services. Care and services provided to victims can be organized into three distinct categories: immediate and concrete services at the time of rescue, services related to recovery, and long-term services pertaining to reintegration. When trafficking victims are rescued, a great deal of counseling services and practical day-to-day assistance will be required. Housing, transportation, food, clothing, medical care, dental care, financial assistance, educational training, reunification for those who wish to return to their homeland, and legal aid are some of the concrete services needed. Although this responsibility does not fall on us, practitioners should connect, coordinate, and case manage these services as much as possible. During this stage, it is also important to understand victims' needs, their strengths, and their risks and vulnerabilities. Safety planning is also crucial in the immediate rescue stage. Traffickers may be continuing to try to locate some victims, so placing victims in safe houses may be necessary. The National Human Trafficking Hotline encourages the safety planning to be based on the unique needs and circumstances of the individual. During the recovery and reintegration stages, as discussed, human trafficking victims experience an array of mental health and psychological issues. Mental health counseling is vital, but it is important to remember that the concept of counseling or talk therapy may be foreign to victims from non-Western cultures. The expression of emotions may be in opposition to cultural values of emotional restraint, which can be intensified by feelings of shame and guilt resulting from experiences with physical and sexual assault. Beyond the paramount importance of the practitioner gaining the patient's trust, practitioners may educate patients about the counseling process and explore their patients' expectations about counseling, health, healing, and recovery. As noted, victims' symptoms may not only be a manifestation of the trauma, but also coping mechanisms to cope with self-blame, shame, and the trauma itself. Given differing cultural beliefs about healing, it is crucial that practitioners be open to alternative treatment and explore with patients the use of traditional healing methods. There are many indigenous healing interventions victims may be using, including cultural rituals, faith healing, therapeutic touch, herbal remedies, and spiritual practices. These interventions are multi-layered, taking into account the physical, psychologic, communal, and spiritual needs. These healing methods are historically rooted in specific cultures, and therefore practitioners should become familiar with traditional healing methods and how they can be integrated with Western counseling techniques.